Today, we're diving into a really fascinating scientific paper that asks a pretty profound question. Could a specific kind of sound actually be used as a tool to calm one of our deepest, most primal fears, the fear of going into surgery?
Just think about that for a second. We all have songs or sounds that make us feel better, right? But could a specific spiritual sound have a measurable clinical impact on anxiety? Well, that's exactly what a group of researchers set out to discover.
And they didn't just pick any old situation to test this theory. No, they went right to one of the most high-stakes environments imaginable, neurosurgery. We're talking about operations on the brain and the nervous system. The level of anxiety a patient feels before something like that is just immense. And for very good reason.
So, to really get our heads around this, here's how we're going to break it down. First, we'll talk about why surgical anxiety is such a big deal. Then, we'll look at the specific sound therapy they tested. From there, we'll jump into how they designed the experiment, and of course, the results. Finally, we'll ask the big question, what could this all mean for how we care for patients?
Okay, first things first. Let's set the stage. The fear a patient feels before an operation isn't just some unpleasant emotion. It's a huge medical challenge in itself.
The research paper makes it really clear that this pre-op anxiety can get so bad it has major real-world consequences. We're talking about surgeries getting pushed back or even canceled entirely. So finding a way to manage this fear isn't just nice, it's absolutely critical for patients and hospitals.
So if anxiety is this massive roadblock, what can you do besides giving patients more drugs? Well, this has led a lot of researchers to explore other options, things that are non-invasive and don't cost a lot.
And this idea doesn't come out of nowhere. The paper fits this research into the broader world of what's called complementary medicine. Scientists have already looked into things like guided relaxation, and especially the power of soothing music to calm a patient's nervous system without having to use pharmaceuticals.
And that brings us right to the heart of this particular study. The researchers framed the recitation of the Holy Quran as a type of therapeutic sound. They even describe it in their introduction as a form of soul-enhancing music. Their big goal was to see if they could scientifically measure its effect.
So, how in the world do you actually test something like this scientifically? Well, it all comes down to a really solid experimental design. Let's break down exactly how these researchers set it all up.
The study had 60 participants. They were all Muslim patients who were scheduled to have neurosurgery. They were all between 20 and 60 years old, and they had all already tested as having moderate to severe anxiety. Now here's the most important part. They were randomly split into two groups, 30 people in each. Okay, this slide is the key to the whole thing. You had two groups. The control group got the normal, standard-issue hospital prep. Pamphlets, a nurse talking to them, that kind of thing. The intervention group, however, got all of that same standard care, plus a 20-minute audio session. That's the only difference. This way, the researchers could isolate the effect of the sound therapy itself.
So what did this intervention actually involve? It was pretty simple and very specific. First, a patient from that group was taken to a quiet private room. Then, they put on headphones and listened to a 20-minute recording of Quranic recitation. And right after that, their anxiety levels and their vital signs were measured again to see if anything had changed.
All right, this is the part we've all been waiting for, the moment of truth. Did it work? Let's dig into the data the researchers collected.
Wow. Okay, the single biggest psychological finding was this number. The group that listened to the recitation saw their overt anxiety scores, that's the anxiety you can kind of see on the surface, drop by an average of 53.5%. And the control group? They showed no significant change at all.
But this wasn't just a feeling or a psychological shift. The physical signs of stress also changed in a big way for that intervention group. Their average heart rate dropped by over 21%. Their breathing slowed down by nearly 21%, and their blood pressure went down too. These are real, concrete, physiological signs of relaxation.
So if you really want to see the before and after, this table from the study spells it out perfectly. For the group that listened to the Quran, just look at overt anxiety. The average score fell from 55.6 all the way down to 38.5. And covert anxiety, that's the internal hidden stress, it also fell significantly, from 57.1 down to 43.4. It's just a crystal clear picture of the intervention's impact.
Okay, so the data is pretty compelling. There was a strong effect. But what does all of this mean in the real world? Let's unpack the study's conclusions and what they might mean for patient care.
The researchers themselves state their conclusion very plainly. Based on what they found, they suggest that listening to the Quran can be seen as a useful, effective, non-invasive, and low-cost way to reduce anxiety for Muslim patients who are about to undergo neurosurgery.
Now, any good piece of science is honest about its own limits, and the authors here are very clear about the boundaries of their work. This study focused only on neurosurgery patients, and every single participant was of the Muslim faith. They directly say that we have no idea if the same effect would happen with non-Muslims. And they recommend that more research is needed to look at other kinds of surgeries and different groups of people.
And that leaves us with a much bigger question, doesn't it? This study gave us very specific evidence for one intervention in one group of people, but it points to a much broader, more powerful idea: the potential for a kind of patient care that acknowledges and respectfully uses a person's own spiritual or cultural beliefs to help them. It really makes you wonder, how can our healthcare systems get better at exploring these kinds of non-drug avenues for comfort and healing? It's a really compelling question for the future of medicine.